Hi, I'm Stephanie, and I'm reporting from day one at ACR 2022 Convergence here in Philadelphia, Pennsylvania. So I started my day out by going to Tiffany's presentation, and it was just absolutely phenomenal to not just hear from her, but from a variety of patients. This was such a historic moment because it was the first ever patient-led session. What they highlighted was the pathway, which highlights research that includes patient research partners. This tool can help researchers avoid duplicate efforts, increase patient voices in the research, and improve value measurements, which is essential and fully encompasses patient-centered research. It was amazing. The second part of my day was attending, it's upside down, my poster presentation, which was online. My poster is called Engaging with the Spoon Theory, and it is an intervention that I created that's based on a cost-benefit analysis calculation that helps patients to make decisions about social events. So as you can see, in my intervention, we did set and determine a value to the importance of an event based on these four variables: the guest list, the fun factor, the rarity of the event, and the value to my career. And we subtract the cost of the spoons required to attend said event. Essentially, the higher the total value, the greater emotional gain. And I hope that patients will use this to help them facilitate the decision-making process. So later in the day, I accidentally entered the exhibition hall, which is a huge room filled with lots of presentations and tables from different organizations. My favorite one by far is called Determination, and it is a new kind of health movement, one that addresses the inequities that exist in psoriatic disease among Black, Hispanic, Asian, and other people of color. It was amazing. I'll read a little bit about what they say on their website. It says, the initial work of Determination is focused on uncovering new data and insight that validates the diagnostic challenges faced by people of color. It's an initiative led by Dr. Grace Wright, who is a rheumatologist and a person of color, a woman of color. So it was excellent. They also have a resource for healthcare providers. It's called Beyond the Textbook, Psoriatic Disease in People of Color, and it's designed to help healthcare providers navigate conversations with their patients, especially patients of color. I'll tell you a little bit about their area, and it's just this huge big block, and it was gorgeous, and it said, we're determined to close the gaps and deliver culturally competent care. It was amazing. One beautiful quote that I really loved said, healthcare providers and patients should recognize that we all have bias. We have to become aware of bias and change our behavior to eliminate health disparities and inequities. It was amazing. Not only that, but they had a little pad where you could make a commitment to delivering culturally competent care. And it said, we're determined to close the gaps for people of color with psoriatic disease. I loved it. It was wonderful.
Well, hello there. This is day 2, technically, of the ACR, but really day 3 because we started on Friday, which was supposed to be a setup day, and then it turned into like a really busy day. But anyway, we said that we were going to do some daily debriefs, and I really wanted to do these after each session, but it just had a little cray day. So first thing, I got up and literally, I'm going to tell a funny story. So I'm going to do a couple of these because it's going to be really long. So got up, we stayed up to 1 last night talking and having some wine. And then I had to get up and go to see the first session of the day at 8 o'clock by our good friends, Eileen Davidson, Chronic Eileen, and who is going with us and one of our Go With Us leaders, and then also Cheryl Crow with Arthritis Life. And well, I got up at about 7:30 and I brushed my teeth and I put a little bit of eye makeup on and lipstick, and then poor Deb was sleeping in the bedroom and I didn't want to wake her, and I knew I was waking her, and I went in and I'm like, okay, I'll just grab my clothes from the night before. So I thought I was all good, and then I get in there and I grab 2 pairs of pants. So that didn't work. So finally got over and got to the session. So I'm sitting actually not at the conference hall. I'm in our apartment because we're taking a little bit of a break on our feet, freshening up, and we're going to go to 2 different events that we have starting in about 35 minutes. So I'll just do the quick one here on this morning. I don't have the name of the session in front of me, but it was on lifestyle, and it was with Eileen and with Cheryl, and we walked in couple minutes late because it was all the way down at the end of the hallway. And so we're like, shoot, hurry in to get down there, and missed the very, very opening. So we're sorry about that, but we did manage to get there in time for Eileen to start. And we heard all about a great story about her life with rheumatoid arthritis, being able to present that to people there. And she had a lot of great slides that talked about like a classic day of like RA pain and not having RA pain and what that looks like. And we thought, oh, we'll make some like quizzes to go along with that and ask you all, because it was just really a cool way of explaining how we're not all the same. And then she also was really reviewing about how with lifestyle changes using an app with the Arthritic Research Canada, or ARC, and she worked as a patient research partner, meaning an equal on the research team. That's what that's all about. So in addition to helping along test the model and giving impact, she was participating. So she was kind of both. She was a participant and a partner. And she talked about how having this app and logging a lot of things actually made her a lot more conscious about things, not like exercise, go to the gym, but exercise like park farther away and walk. That kind of thing. And just some simple life changes that we could think about as patients. So kudos to them. And Cheryl spoke as an occupational therapist and gave some additional tips on your life and lifestyle changes. And she's just so darn funny and naturally just as cute as can be. So we will give a bigger update, I guess, in some follow-up debriefs. But I just wanted, that's how I started my day. So that was just part 1. So now it's called Tiffany's Debrief part 1, because I'm going to have to do it. Deb's over. There's Deb. What up? So, all right, I'll be back. I just realized I turned on my phone, and I'm not talking to you, Deb. I'm actually talking on the video. But I switched hands because my thumb was getting tired, And I realized I'm laying back and reclined. I look like I should be like smoking a big cigar and like having a scotch. But anyway, so I digress. I'm going to save some of the updates on the other 2 sessions that I went to, because I went one with Lindsay and I went one with Leila. And so I wanted to do the debriefs with them. But I thought I will just give a couple shout outs and also tell you about a product that you will see at least on our Facebook social media. It was called Pain Away. Look at that. Pain Away. We like that name. And this sucker was like it's for it was designed for fibromyalgia, which we all know is a main comorbidity with our diseases. And these men who work at this company, this medical device company, came up to our booth because they saw our diseases, and they're working with patient organizations about pain. And I was very, full disclosure that fibromyalgia is not one of our diseases. It is a very high comorbidity, and we do also have a lot of friends that have fibromyalgia and different organizations that we could help connect them to as well. And saying that, Kelly Conway, who is our co-founder, she was at the booth and has comorbidity fibromyalgia, so she got a free pain treatment while we were sitting there. And she said literally she could barely move her arm all day, and she had no problem lifting her arm afterwards. And she had a lot of other amazing honest comments right after, and I kind of bumped the guys. I'm like, are you recording this? Because that was great testimony. So anyway, we're going to talk about how we can collaborate with this company on their pain therapies and a lot of other things they're doing in research with non-pharma options that are for inflammatory in general and not just on fibro. So that was really cool. And met a couple rheumatologists that came by, and then I'll let other people who were working the booth kind of give updates on that. That just happened to be while I was standing there. So I did, next to us is the National Psoriasis Foundation, and then Coalition of State Rheumatology Organizations is on the other side. So I said hi to them at CSRO. Then I went over and I said hi to National Psoriasis, and they're like, oh, we know you. And then I realized I had talked to that person already. So said hi to her, and then she said, your booth has been so busy all day. So when somebody next to you says that, and it was the National Psoriasis Foundation, that is always a good sign, because they're noticing, why is all the traffic going over to that booth? So that was really cool to hear. Anyway, I am getting ready to go with Deb to social number 1, and then we are heading over to meet everyone else at social number 2, hosted by the Lupus Foundation of America. And that's it. That's a wrap for today, at least for now. Talk to you later.
Hey everybody, it's Lindsay, the Public Policy Manager.
And I am Deb Constein, longtime volunteer with AI Arthritis.
We just got done with a session about advocacy, and it was super basic. It was geared toward clinicians who have never done advocacy before. So it was new information from us, but there were a lot of resources that we found that we're going to write down and that we can use for our Knowledge is Empowerment project. Information about that coming soon. And earlier in the day, I went to a reproductive health session, which was super interesting to me because my background is in reproductive health, and I'm translating it now into AI arthritis. But it was talking about all the things that we have to think about as women when we talk about our reproductive health having these diseases.
Okay, and my day started going to the Great Debate. So it was to treat oh my goodness, I'm brain fogging. Rheumatoid arthritis, so pre-rheumatoid arthritis. So they're talking about using the technology of biomarkers and seeing other things that are like making the doctor think that you are a precursor to having the rheumatoid arthritis. So to treat with DMARDs or not to treat, and it's a debate. So they actually present their sides, both teams, the teams of 2 doctors, and what I said afterwards is they did such a good job, both sides, and they were actually able to do rebuttals and things like that on both sides and answer questions. And there's a lot of humor, because the first team that went was, they said, the second team came up and said, we heard the delayed applause. So that's just making a point. It was just, there's like humor in there. They have a lot of fun, but I came away with not a clear winner because as a patient, I put myself in the shoes of being given that conversation by a doctor. Do I want to go on those heavy medications with major side effects, or do I just want to wait and see? And they also said that if you did get RA and you were treated with the DMARDs, that you would not necessarily have as severe a case of RA. So it was interesting. I really liked that session. So, and then I attended the advocacy, because again, advocacy is something that I'm well versed in and probably 10 years into it and love every bit of it. So we didn't learn, like she said, Lindsay said, there's not a lot of new information, but great resources. All right. See you later.
Hi everyone, my name is Leila and I'm the Health Education and Engagement Manager here at AI Arthritis, and I also have Lupus Nephritis, and I'm going to be reporting back on the 3 different sessions that I went to today. The first session that I went to today was Telemedicine and Telehealth in Rheumatology, and there were a few different speakers. The first speaker talked about a remote therapeutic monitoring app for rheumatologists to be able to use in their practices. It is with the Global Healthy Living Foundation and Creaky Joints, and it's basically to increase patient-reported data for rheumatologists to be able to analyze, and it's supposed to help with monitoring flare activity, with tapering therapy. So when you need to taper off a medication, to be able to report that and report your symptoms for your doctor to be able to see. And also with new drug initiation, basically monitoring any symptoms that may happen with a new drug being introduced. They also talked about how with telemedicine, there's a lot of opportunity to expand shared decision making. And also there could be opportunities to maybe incorporate infrared cameras in order to detect inflammation. And also they just gave a big disclaimer and a warning that once the government declares that there's officially an end to the pandemic, that it will cause a disruption in telemedicine, and that it's going to be different for each state. So just beware of what the policies are in your state, and beware that there may be some changes once the pandemic is officially declared as over. The second session that I went to was Young Patients with Big Ideas, Revolutionizing Healthcare and Research. And they were a part of the Young Patients Area or Autoimmune Research Empowerment Alliance. And there were 4 young women that were on the panel answering questions about their story and things that they think should change in healthcare and in research. And it was an amazing panel, being able to hear all of their perspectives and their passion for wanting to improve patient situations and things like that, and being able to participate in the design of research and not just be a part of research as a patient. And I think it's super important to remember that young people do have just as loud of a voice as anybody else, and that they are going to be the future of all of this, so we should start to listen to them now. The last session that I went to was about lupus nephritis and a new drug that just came out and was approved by the FDA, and it's called Lupkynis, or the generic name for it is voclosporin, and it's meant to be an add-on drug to the normal standard of care, which is usually mycophenolate mofetil and prednisone, either high dose or low dose. And so this medicine is another add-on additionally to Benlysta that was approved I believe in 2020 or 2019 for lupus nephritis also. And so voclosporin is a pill that you would take instead of being an infusion or an injection like Benlysta is. And so we just got to see a lot of the results from the clinical studies that they did, and basically see how much adding this drug to a lupus nephritis patient's regimen will help to decrease their proteinuria and their increase their GFR. And yeah, I just thought that it was so cool to hear about a new drug for the disease that I have, and really awesome to see that there's more drugs coming out to help all the different patients that may not be responding to the regular standard of care. I had such a fun time today being able to attend all of these different sessions. I was able to attend a lupus session today, which I'm so excited about. My schedule got pushed around yesterday, so I wasn't able to get to all the lupus sessions that I want to, but the one that I did get to attend today was very meaningful and very interesting to me, so I'm so happy that I was able to. I also was able to walk around the exhibition hall a little bit more and get to see a lot of the other patient organizations and a lot of the other booths that were there. And so yeah, I'm really excited to be here and so happy that I was able to report back to you all on the different scientific sessions and panels that I went to. Thank you.